I'm the medical director for El Camino Sleep Medicine Center. I've been practicing sleep medicine for well over 10 years, and we're going to talk today about obstructive sleep apnea. We're going to talk about diagnosis and treatment, just in general, what sleep apnea does and how that impacts other conditions.
好，那大家好哈，我是Tony Masri 医生哈，我是神经科的医生，也是我们睡眠科El Camino 医院睡眠科的主任哈。我做这个睡眠的这个医生呢，已经有超过10年的时间哈。那今天的这个讲座呢，我们主要是会跟您讲说如何来诊断是您的睡眠呼吸暂停症哈，同时治疗的方式有些什么，同时呢，对于其他病症的影响有些什么样的情形。
So this is what I just already mentioned. We're going to talk about how often apnea happens and how we treat it. First,
所以呢，我们就会跟您讲说这个睡眠呼吸暂停症呢，它发生的频率有多高哈，然后呢，我们诊断了之后呢，要怎么样来做治疗。
Okay, so apnea affects a little more than sleep. But before we go there, let me show you how the breathing happens. This is normal breathing.
所以呢，这个睡眠呼吸中止呢，它不是只是影响到睡眠，它还影响到很多其他的方面哈。那我先告诉您说，这个呼吸这个什么样会受到暂停的情况，我来跟您讲一下。
So this is what it looks like when we're breathing through our nose.
这是像我们用鼻子呼吸的时候是这个样子的。
And this is how we start having collapse in the back of the
这边呢就看到这个肌肉塌陷下来了哈。
So when we do that, there's a signal in the brain that tells us to take a deep breath and open.
那在这种肌肉塌陷下来的时候呢，我们就给脑子送了一个讯息，告诉你说，你需要做个深呼吸了。
And that signal can raise the blood pressure and the heart rate, our blood pressure and how fast the heart is beating.
那因为这脑子接到了这个信息哈，所以在这个时间点呢，我们的血压会增高，我们的心跳也会增快。
So it gets our respiratory muscles, our muscles of respiration, contracting. It gets the heart going fast, but it also creates inflammation in our blood vessels.
所以呢，在这种情况之下呢，我们的呼吸的肌肉就会变得很紧哈，然后心跳也会加快，然后呢，也会造成我们这种发炎的指数呢也开始增加。
And then after all that, the airway opens up again and we breathe.
所以一旦这个情况发生了之后呢，我们才会把这个通道呢打开来，才能够继续的呼吸。
So this is what we look at when we do a sleep study. So when someone comes into sleep lab like El Camino, we measure their respiration, their breathing.
所以当病人来到我们这个 El Camino 医院来做这个呼吸睡眠测试的时候呢，我们就来看看他呼吸的这个情况。
And we notice the breathing stops, and then we have this EEG, which is the brainwave activity, goes really fast, and we can see that you start waking up a little bit.
那我们看到他的呼吸改变，那我们也可以用脑电图可以看到说，因为呼吸的改变造成脑里头的这个活动呢也是不一样，然后血压也会增高，然后血氧也会减低。
And the blood pressure goes up and the oxygen drops that you see here in yellow.
您看到下面这个图形哈，血压那个紫色的往上了，然后血氧呢黄色的往下降了。
So the brain wants to get more oxygen because of the apnea, so it raises the blood pressure.
那脑子呢，它需要更多的氧气哈，所以呢，它就让血压会增高，让它能够多得到氧气。
There's also inflammation that happens where our cortisol level goes up and affects our insulin, so it makes the diabetes worse.
那所以在这种情况呢，它的皮质醇也会增高哈，那也会影响到我们的胰岛素，然后这种情形都会发生的。
So the oxygen can drop really low. Normal is 96, it drops to as low as 60.
血氧的会改变很大哈，正常的算是在96，可是它如果有暂停的情况的话，可以降低到60左右。
So it affects our brain function. Our brain is not going to work as well.
会影响到我们脑子的功能哈。
And our heart muscle becomes weak over time.
那随着时间的进展呢，我们心脏的肌肉呢也越来越弱。
So how do we define apnea? So we measure how often someone slows down or stop their breathing every hour.
所以呢，我们怎么样来说您到底是有没有睡眠呼吸暂停症呢？我们是来评估哈，在1个小时之内，您会有这个呼吸暂停的情况会发生几次？
So if they stop breathing less than 5 times an hour or slow down less than 5, that's mostly normal. If it's 5 to 15, that's considered mild. 15 to
所以呢，如果说您这个暂止呼吸哈，或者是说呼吸减缓的话，小于是1次1个小时少于5次的话，算是正常哈。那如果是5到15次的话，算是轻度。
So and then over 30 times an hour is considered severe.
如果说1个小时超过30次的话呢，我们就称为这是严重的了。
Okay, and so now who has sleep apnea? If any of you have any of these conditions, I'm going to tell you what are the chances of you having apnea.
所以呢，是谁会有这个睡眠呼吸暂停症呢？上面我显示出来的这些疾病的，我告诉您说，你有这种疾病的话，您得到睡眠呼吸暂停症的这个可能性大概有多少了？
So if you have, for example, had a stroke,
比如说呢，您有中风的话。
or you've had high blood pressure that's you've taken more than 2 blood pressure meds, you have as much as an 80% chance of having apnea.
如果说你有高血压，而且服用2种以上的高血压药的话，那您大概有80%的可能性您是有这个睡眠呼吸暂停症的。
If you have heart failure, it's 76%.
如果您有这个心脏衰竭的情况的话，您的百分比大概高达76%。
So if you have irregular heartbeat, it's almost 50%. It's 49%. That's atrial fibrillation.
如果你有房颤或者是心律不整的情况下的话，您得到这个睡眠呼吸暂停症的可能性50%。
So sleep apnea and high blood pressure, hypertension go together and increase the risk of stroke.
所以呢，您的睡眠呼吸中止症跟高血压是绝对相关的哈。那造成这个情形的话，就很容易有中风的情形出现。
So if someone has moderate sleep apnea, which is 15 times or more an hour, they're 3 times more likely to have high blood pressure, to develop high blood pressure in 40 years.
所以呢，如果说您有中度的睡眠呼吸中止症的话，您在4年的时间里会产生有这个高血压的情形，几乎是别人的3倍以上。
So it's really important if you have moderate obstructive sleep apnea, not even severe. Obviously, if you have severe, it's also true. To really treat apnea, so you don't develop high blood pressure.
所以呢，如果你有中度的这个睡眠呼吸中止症的话，更不用说是重度的了哈。绝对建议您一定要去把您这个睡眠呼吸中止症的这个情形呢接受治疗，这样子的话，您就不会产生这个高血压的问题了。
So basically, your blood pressure can go up with every time you're having an apnea episode in the middle of the night.
因为呢，您每次呼吸暂停的时候呢，您的血压都会升高哈，每一次发生都会发生。
So, like you can see here, 50% of patients with apnea can have blood pressure. Treating apnea, especially with CPAP, can help with your blood pressure.
所以您可以看出来哈，50%的病人如果是有睡眠呼吸中止的话，都会有高血压的情形哈。那如果我们能够用 CPAP 这个睡眠呼吸机来帮助您的话，这个风险就可以降低。
So what happens basically is your blood pressure when you go on CPAP can drop by as low as 10 points, which is a big deal.
所以呢，您如果用这个呼吸机的话，哈，您的血压可以降低几乎10点，哈，所以这是非常重要的。
So we mentioned that apnea can cause heart attack and strokes.
我们说了哈，这个睡眠呼吸中止会造成心脏病发或者是中风。
The good news is, if we treat apnea, your risk drops quite a bit.
可是好像是说呢，我们接受了治疗的话，您这个风险可以降低相当的多。
So over a period of 10 plus years, you can see here, the blue is normal, people don't have apnea. Green are people treated with apnea, and red are people not treated. And so the risk goes up really high the longer you have apnea untreated. But if you treat it, you look almost like someone who doesn't have apnea.
所以我们看这个图形可以看出来哈，蓝色的呢就是说正常没有睡眠呼吸的哈，那如果说接受治疗的话，就是绿色的跟蓝色的没有差多少。可是如果您不接受治疗的话呢，您就可以看到说您这个风险会绝对的增加，非常非常的高。
So the graph I just showed you for non-fatal heart attack and stroke. So heart attacks and stroke that don't cause someone to die. But in terms of dying, death rates, there's also a difference in terms of how likely you are someone to die if they have sleep apnea, treated, untreated.
所以呢，刚刚讲的呢，是因为这个心脏病啊、高血压这些心脏病啊、中风影响的哈。那现在呢，你也看这个图呢，你也看出来，如果说有接受治疗的话，哈，这个死亡率呢也是很能够接受治疗的话，是降低的相当的多。
So how do we know? How could we find out that it has apnea? About 10% of the general population have apnea. Most people don't even know that they have it. So how do we find out if you might have apnea?
所以呢，大部分呢，一般的人群里头呢，大概有10%的人是有这个睡眠呼吸暂停症的哈。那可是大部分人根本都不知道自己有这个问题。那我们怎么样能够察觉出来说这个人是有睡眠呼吸暂停的情形呢？
So basically, here are some symptoms.
所以这里有一些症状，刚刚提醒您。
Snoring.
打鼾。
So if you're snoring, and especially if it's just as loud as talking, or you can hear someone in the room next door snore, that's a big sign.
如果说您给我听到人家打鼾哈，您或者在别人的隔一个房间里到那个人在打鼾的话，这就是一个很明显的这个警示了。
So if you notice someone also stop breathing or gasping for air when they're sleeping, that's a very, very clear sign.
那另外的一个警示呢，就是说，如果您注意到您身边的人哈忽然停止呼吸，或者是说一下醒过来哈强烈的急着要呼吸哈，或者是有这个被呛到的那种呛到了、捏到的那种情形的话，这也是很明显的警示。
So also, if you notice someone sleepy and tired, and they don't have other reasons to be sleepy, that's an important sign.
那另外呢，如果你看到有人呢，就是白天的时候很困，而这个很困呢，没有什么其他明显的理由能够来解释。
So another important sign is if someone says, doesn't matter how much I sleep, I still wake up sleepy and tired, that's another sign.
另外一个警示呢，就是说有人说我不管我睡了多少个小时，我醒来了之后呢，我还是觉得很累，还是觉得很困，这也是一个警示。
Other signs include obesity if you're overweight.
另外还有包括就是说如果说您过重
high blood pressure,
血压高
atrial fibrillation, which means if you have an irregular heartbeat,
房颤或者是您的心律不整
retrognathia, which is another term for having a narrow jaw. If you have an overbite, you have a smaller jaw.
另外呢就是说您的这个下颚比较小一点
So this is what I mean by smaller jaw. So if you look at someone, this is their nose, you see the smaller jaw is a little smaller.
可以看到这个人的他的这个下颚就是比较小一点哈，而且他的上牙这个地方注意一下。
And this is their overbite here that they have.
他的牙齿呢，上面的牙齿是咬在这个下面的牙齿之这样子照过去哈，这个叫做 overbite。
And if they have their high arch palate, if the roof of their mouth is high up, that's also another sign.
而且他的那个嘴巴的上颚的那个地方哈非常高，这也是一个警示。
The palate is important because if your nose is a tent,
所以上颚这个这个顶尖的这个地方呢是很重要的。您假设说您的鼻子是一个笔的话
the base of that tent is the roof of your mouth, like the palate.
所以呢这个鼻子尖的地方，它的底部呢就是您这个上颚这个地方的，是您这个上颚就是它的底部。
If your palate is wide, you have more opening for air. If your palate is narrow and high arch, you're not going to have as much room for air through your nose.
所以您的上颚如果比较宽的话呢，这个空气就比较容易进去；如果您的上颚比较紧比较窄的话呢，您这个空气就不容易上去了。
So it's another picture of rethronathia. So what you're looking at here, this is the jaw, this is the
所以
tongue.
可以看到，这就是您的下颚这个地方哈。
And this is the spine, this is the back.
这是后面哈，喉咙这边。
So anything that makes this distance narrow,
所以任何情况哈，让您这个从嘴巴到您咽喉这个地方的这个距离越短的话，
makes it more likely for someone to have apnea.
您就更容易是会有这个睡眠呼吸暂停的情况了。
Another way we can find out if someone has apnea or we suspect it is by looking into their mouth.
那另外我们可以看出来，或者是怀疑这个人是不是有睡眠呼吸暂停症呢？我们是可以看他的嘴巴张开来，让我们可以看出来。
So we have something called the Malampati classification, which is organizing or figuring out how narrow someone's palate from 1 to 4.
所以呢，我们有一个叫 Malampati 的这个分类哈，就是我们把这个人嘴巴张开来之后呢，分成4种等级。
So if you look in someone's mouth and then you have them stick their tongue out,
所以呢，你让一个人看张开嘴巴哈，然后把舌头伸出来，我们来看，
you can tell how open the airway is.
你可以就看得出来他这个气管的通道有多大。
So with one that you see here, looks wide open. You can see the uvula, you can see the back of the throat, no problem.
所以这第一个呢，你就可以看得到它的气管的通道是相当大的，没有问题。
And then the more narrow it gets, the number gets up. So 4, you really can't see much. 3, you see a little bit, and 2, you see more, but it's not as good as 1.
所以呢，数字越高呢，表示说我们能够看到气管这个的通道越来越小哈，这个情况就比较严重一些。
How can you find out if someone has apnea?
所以您怎么样能够知道这个人是不是有这个暂停症呢？
You can ask him questions. Ask if they snore, if they're tired, if they're sleepy, if they have high blood pressure.
你可以用问的方式哈，看他们是不是会不会觉得累呀，有没有高血压呀，会不会觉得困啊，问他们这些问题。
And sometimes it's really hard for your primary care doctor to stop in a busy clinic and ask you all these questions.
那有时候呢，在家庭医生那边呢，很困难哈，没有这个时间来问你这些问题。
So we use this screening tool called STOP, and there's STOP Bang. So what does STOP mean? It's an acronym.
呀，所以呢，我们在诊断的时候呢，我们常常用这个 stop 这个东西，这几个字哈，来代表哈，来让我们来筛检是不是有睡眠呼吸暂停症。
So S stands for snoring, which is as loud or louder than talking, or whether you can hear someone in the next room.
S 呢就代表是说是打鼾哈，就是说您的这个打鼾的声音是比您讲话的声音还要大哈，您是不是有人睡在您隔壁都可以听到您打鼾的声音。
And then two is T is for tired. O is you've observed apnea.
那 O 的话就是代表是说您有阻塞性的这个暂停症。
And P is for pressure, high blood pressure. You notice me talking a lot about blood pressure because it's important.
那 P 呢，就是代表血压哈，就是血压会高，我们血压高这是非常重要的一件事。
So your chances of catching severe apnea are about 80%. So if someone answers 2 out of 4, you have an 80% confidence you're going to catch them with severe apnea.
所以呢，借着这个 STOP 的问卷的方式哈，我们能够知道这个人是不是有严重的睡眠暂停症呢？大概是有80%的情况，大概有8%的可能都可以找得到。
And then you use something called, if you add the bang part.
另外还有一个方式叫 BAN 好 ，B 是这个是体重质量。
So yeah, B stands for body mass index over 35. So overweight is over 25, obese is over 30.
所以呢，如果说您的体重指数呢是超过35以上的话，哈，那这个可能性就大，因为通常在这个身体的体重指数如果是在30以上的话，我们就称为是肥胖症了。
So if you're over age of 50 is another risk. That's the A.
A 呢是代表是年纪哈，如果你的年纪超过50岁以上的话。
N is for neck circumferences. Someone's neck is more than 17 inches or 40 centimeters. That makes it more likely for you to have apnea.
那 N 呢，就是您脖子的这一圈哈，如果是超过40公分或者是17个英寸的话，您得到睡眠呼吸暂停症的可能性也比较高。
And if you're a male, men have more apnea. They're 3 times more likely to have apnea than women.
那另外 G 的话就代表是您的性别哈，男性比女性更容易得到睡眠暂停症，而且它这个可能性是高过女性3倍以上。
So this guy is obviously, very typical. He's got the big neck. He's older. He is also probably overweight. So he would be a very classic person to have all these risks.
所以您看图片里头的这位男性呢，他就是符合很符合我们这些的条件哈。你看他看起来年纪比较大哈，颈子也比较粗，然后呢看起来也有一些这个过重的情形，又是位男性，所以他是标准的这个睡眠呼吸中止的病人。
So once you do the stop and the bang, you're almost 100% going to catch people who have severe apnea. Even 84% if they have mild apnea, you're going to find out.
所以呢，如果您经过 STOP 跟 BAN 这2个筛检的程序的话，能够能够确诊这个病人是有严重的睡眠呼吸中止症的，几乎是100%的可能哈。即使轻度的话，也有80%以上的可能性。
So let's talk about treatment. So what are the treatment options? So CPAP is 100% effective.
我们现在来讲一下这个治疗的方式哈。那治疗的方式，第一种呢，就是用 CPAP 这个睡眠呼吸机哈，那它几乎是100%有效的。
So that's the first question. It's 100% effective. The other issue is that it has no side effects.
而且呢，它几乎是100%有效，而且呢，它没有任何的副作用。
And it's covered with your insurance.
而且保险公司也会给付。
Even if it's not covered through insurance, it's pretty inexpensive. It's not cost much.
即使说保险公司不给付的话呢，它也不是那么的昂贵哈，不会让你们没有办法负担。
Okay. The other option is a bite guard. It's an upper and lower bite guard that you would wear, and it helps you reduce your apnea. And it's not as effective as CPAP. It's about 50% as effective compared to CPAP. So it can be helpful, but not as helpful.
那另外呢，一个就是放在嘴巴里头的一个仪器哈，它的有效程度呢大概是50%左右，不像是用睡眠呼吸机这样的效果那么高。
And hopefully I'll show some pictures. Weight loss is important. The same way weight gain can cause apnea, losing weight can be very helpful.
所以呢，如果能够把体重减轻的话，对于您的睡眠呼吸中止呢，也是非常有用的哈。因为体重增加的话，这个得到睡眠呼吸暂停的可能性就增加了。
So usually, if you lose 10% of your body weight, you reduce your apnea by 20 to 30%.
那通常呢，如果您能够减轻10%的体重的话，您就可以减低20%到30%的可能性得到睡眠呼吸暂停症。
Excuse me, my allergy.
我的过敏很糟糕哈。
So if you lose 20% of your body weight, you're gonna reduce your apnea by half.
如果您能够把体重减轻20%的话呢，您得到睡眠呼吸暂停的可能性呢，就可以减低50%了。
So also other options I'm going to talk about before we talk about surgery.
那我们还有在讨论手术之前，还有其他的方式哈。
If you sleep with your head elevated, we're talking about 10 inches where your head is above your feet. Or 30 degrees.
所以呢，另外呢，如果说您睡觉的时候哈，您的这个枕头哈，头能够比你的脚高过10英寸，也就是大概是呈30度的角度。
So that would reduce your apnea usually by 20%, depending on how bad it is.
那这个看您这个睡眠呼吸中止的严重度有多少哈？如果我们这么做的话，大概可以减少20%到30%左右。
These usually work well when you do multiple all at once.
那这些选项呢，通常就是说，如果您能够好几样一起用的话，那会更有功效。
So if you have trouble using CPAP, it's good to do an oral appliance, lose weight, maybe elevate the head of the bed, among other things.
所以呢，如果说您对睡眠呼吸机没有办法使用的话呢，您最好呢嘴巴里头能够放这种仪器哈，减轻体重呢，同时睡觉的时候呢把头抬高这些呢一起用，那也是有帮助的。
So other options include surgery, and there are different types of surgery we're going to talk about.
那其他呢，我们就是另一个方式呢，就是要做手术。那手术呢，也有各种不同的方式，我们等一下会来讨论。
So with surgery, we can do either nasal surgery, just fixing the nose, which is not very effective by itself, but it can help maybe 10-20%.
那这个鼻腔的手术呢，不是那么有效的，大概只有10%到15%左右啊。
There's soft tissue surgery where they cut basically tissue in the back of the throat. I really don't recommend the surgery.
所以呢，另外还有呢，就是把您的这个软组织在您喉咙后面的软组织把它切掉哈。那老实说，我实在是不建议大家做手术。
The other option in this case is bone surgery, basically breaking up the upper and lower jaw and bringing it forward.
另外呢，一个手术呢，就是把您这个额骨这边呢，把它打断哈，然后把您的下颚往前推，用这种手术的方式。
So I'm starting to see some questions. Maybe I can see there's 2 questions about CPAP. I can answer those, but I'll answer those in the next 2 slides.
所以呢，我看到有一些问题已经进来了哈，所以呢，我在接下来的几个投影片里头会来回答这些问题。
So let's talk a little bit about how CPAP works, and then I'll tackle the questions.
我们来告诉您说这个睡眠呼吸机是怎么样的使用，然后我再来回答这些问题。
So the word CPAP stands for continuous positive airway pressure.
所以 CPAP 它是代表的就是持续的正压的气管的压力。
So how does CPAP work?
那这个机器是怎么样产生功用呢？
So with CPAP, basically you wear a mask, it pushes lightly pressurized air to keep the whole airway open.
这个用这个机器呢，它就给你一些轻微有压力的空气打进去，好让您的气管能够张开。
So I think now is a good time to pause, and I'm going to answer these 2 questions.
所以我觉得现在是个停的好时间，我来回答这2个问题哈。
So Sophia asked, do we need CPAP machine if the apnea index is mild, 5 to 15?
所以 Sophia 问了一个问题哈，说如果说我的这个睡眠呼吸暂停症是轻度的，是在5到15之间哈，我是需要用睡眠呼吸机来治疗吗？
Is it dangerous, and will someone get a stroke?
那同时他的问题是说，如果说我不做治疗的话，是不是很危险的？会不会造成我有中风的情况出现呢？
So the short answer is no. Most of the time, no, you don't have to treat it, but there are exceptions.
所以我很简短的来回答的话是说，您暂时是可以您是可以不用接受治疗的，可是还是有例外的状况。
If someone is healthy and doesn't have symptoms, doesn't feel tired, doesn't feel sleepy,
如果这个人很健康哈，而且没有任何症状出现，不会觉得累，也不会觉得困，
then you don't have to treat it.
那我就会说您不需要接受治疗了。
But if it's moderate, 15 to 30, you should treat anyway because it can raise the risk for blood pressure.
可是呢，如果说您的这个指数是在15到30之间的话呢，那我就建议您要接受治疗，因为它会增加您的血压。
So if you have mild sleep apnea, 5 to 15, and you have atrial fibrillation, other heart conditions, or bad high blood pressure, like it's hard to control the blood pressure with 2 meds or more, then
Finish, please.
Then you should treat it with CPAP.
可是如果说您的这个睡眠呼吸中值的指数是在5到15，是在轻度的情况，可是您有房颤，而且呢您的血压呢不容易控制，即使吃了2个药之后呢，都还是维持在高的情况下，在这种情况下的话，您就需要来治疗您的睡眠呼吸中止症了。
So the next question becomes, well, if someone starts on CPAP, do they have to stay on CPAP for life, and can they travel with it?
下一个问题就是说，我如果一旦使用这睡眠呼吸之后，我是一辈子都要用了哈，那我是不是旅行的时候都要带着呢？
So the answer here is yes, usually, but it depends. So usually the CPAP you can easily travel with it, no problem. It's small. You can take it as an extra carry-on. It doesn't count as an extra carry-on a plane because it's a medical device.
所以呢，回答这个问题呢，答案是说是的，这是一辈子要用的哈，而且旅行的时候呢，带起来也很方便，因为呢，它就是您的随身行李哈，这是因为这是医疗的必须要用的东西，所以它不会算是你一件额外的这个随身行李您还是可以带您自己平常需要的随身行李的。
So when you travel, well, once you start on CPAP, the idea is to be on CPAP for as long as for as long as possible. But if you lose weight or you have surgery or something, you might not need CPAP after that time.
那我们用这个睡眠呼吸机的这个概念呢，是说是一辈子都要用的哈。可是如果说在这个过程当中哈，你体重减轻啦，或者是说你有做什么手术的话，那可能就是不是用一辈子的事。
So the question was, if I have irregular heart rate and blood pressure is line, do I need to try CPAP? I would recommend yes. It's hard for me. I would recommend yes. Let me give you a chance.
有人就会说的，如果说是您这个心率不整哈，那这个血压又是在这个边缘地带的话，他会不会建议您要用这个 CPAP 的这个机器？医生的答案是说是的，他会。
You don't get addicted to CPAP too. You can stop using it if something comes up.
所以呢，您并不是说用了这个 CPAP 的机器之后，您就会上瘾了，必须要用哈。您任何时间你要停，您是都可以停的。
So it's very important that when I answer questions here, I'm not giving you very specific answers for your own health because I don't have all your information. I'm just giving you general advice here. So please don't take it. You have to still talk to your doctor, your sleep doctor, your primary care doctor.
所以大家请注意哈，我现在给您的答案哈，都是一般的答案哈，并没有针对您个人的情形哈，因为我没有您个人的病例，我只能就一般的情形来置评哈。所以呢，请您有正确的有真的问题的话，还是要去看您的医生的，不要以意见来当做是一种建议就该这么做。
So there's a question about problem with CPAP, which I'll answer in a couple more slides. But
那等一下还有一个问题就是说，有人用了这个 CPAP 之后有一些出现哈，我等一下再用一两个投影片，我就来回答这个问题。
So it's very important to know that the traditional model of CPAP is very different than what we do at El Camino when we help patients use CPAP.
Can you repeat that one more time? I'm sorry.
That's okay. The way most people prescribe CPAP, the traditional model, is different than what we do at El Camino in terms of helping people get on CPAP.
所以呢，传统的这种用这个睡眠呼吸机的方式哈，跟我们在 El Camino 医院呢帮助病人开始使用睡眠呼吸机这个机器呢，方法是不太一样的。
Most places will just prescribe CPAP and then hand you a machine. And it's not very good because you don't know what to do with it and how to use the machine.
很多人呢，同时都是也就是说帮您开一个处方，让您要用这个机器，然后就把您交给这个供应商了哈。那这对这个方法呢，对您来说呢，是不是呢很有帮助的？
So at El Camino, we do education, custom fitting to help you find a good mask, and we monitor how you're doing with the machine.
那在我们 El Camino 医院里呢，如果我们告诉您说要用 CPAP 的话，我们可以给您提供教育，并且呢帮您量身定做来戴您的面罩，然后呢会观察您，然后呢帮您解决是说您要持续戴的这个问题哈。
So solving adherence problem, we troubleshoot. Someone brought up a question. I'll answer it here in a minute.
所以呢，有些人呢用了机器之后呢，就不能持续的戴好哈。那我们会帮着您来解决这个问题，因为刚刚在问题里头就有人已经问到了。
So one of the questions someone asked, I said, well, I start using CPAP and I feel extra air in my stomach. And the reality is that can happen, maybe 10% of the time. The solution for that could be as follows.
好，所以呢，跟问题里头就有一个人说到呢，我用了 CPAP 的这个机器之后呢，觉得胃里头这个空气非常的多哈。那这个确实大概在10%的病人里头呢，是会发生的哈。那我会告诉您说下面的情形。
So one of the things we do is we can reduce the pressure and then slowly increase it up again.
第一个我们可以做的方式呢，就是先把你的压力先减低，然后再慢慢的把它加上去。
The other option would be to elevate the head of the bed a little bit. That can reduce the air swallowing.
那另外呢，就是您可以把这个床头摇高一点哈，这样子的话也可以减少您这个吞到空气的可能性。
Sometimes if you have heartburn or reflux, it's good to treat that and talk to your doctor about it.
那如果你有烧心或者是胃酸逆流的情况的话，您最好也跟您的医生去讲，然后来接受治疗。
So, and there's 2 more questions about CPAP I'll address in a minute.
那另外还有2个问题哈，我等一下会跟你们回答的。
So again, our model, we do a lot of follow-up. We have respiratory therapists, we have sleep technologists. We monitor your machine from far away to see how well you're using it.
所以呢，追踪呢，我们有很多的哈，我们有呼吸治疗师哈，也有睡眠的技工哈，然后呢，我们又可以有远程的监控哈，来帮助您。
So in our situation, we have 70 to 90% success of getting people to use CPAP compared to 34% when people just hand someone a CPAP.
那所以在我们这种的程序下面呢，我们可以成功的帮助病人使用这个睡眠呼吸机，高达70%到90%。而一般如果说您只是开个处方，然后到外面的供应商的话，成功率大概只有34%。
So those are what success looks like here is basically being able to use the CPAP, being comfortable with it, and having good results. Because CPAP is supposed to provide 100% improvement, and so that's why it's what success looks like.
所以呢，我们如果能够帮病人坚持的使用这个睡眠呼吸机的话，哈，那这是对病人是100%的有效的，会对病人产生很好的效果。
So that's mostly the questions here. I'm gonna go back to the last slide because so I'm gonna answer some. I'm gonna give time to the Q&A. We got done a little early, which is okay. So I will answer everyone's question as they come.
好，我们今天呢稍微早点时间都结束了哈，那我会回答大家问题。